of the panel.
Thank you, Luma. Thank you so much for that very nice introduction. First of all, let me start by saying that it's an honor to moderate this panel discussion with each and every one of our dental students here today. As Luma said, my name is Esther Lopez, and I am from Chicago, born and raised. I live in Oak Park, which happens to be a suburb west of Chicago. It's the very first suburb that you encounter right after leaving what's called the Austin neighborhood, one of the largest neighborhoods in Chicago. I live with my amazing two kiddos and husband. Nathaniel is 15 and Nico is 13. I am a general practitioner. I own my own practice. I'm also an adjunct faculty member for UIC College of Dentistry, where I am able to supervise and also work at a nonprofit organization by the name of RefugeeOne. That clinic is one that caters to refugees, asylum seekers, immigrants, people that are coming from all over the world trying to escape persecution. So it's an amazing opportunity for me to give back and then also to work alongside dental students to continue offering them hands-on skills on cultural humility. And like Luma said, I am currently the president for our chapter in Chicago, the Hispanic Dental Association. Besides that, I'm the treasurer for our local Chicago Dental Society, and I am part of the leadership team for our state dental society, two committees, the communication committee, and then also the newly formed diversity, equity, and inclusion committee. So that is me in a nutshell. I am super excited and eager to open it up so that our panelists can introduce themselves. Who wants to go first?
I can go. Good evening, everyone. My name is Cassidy Barnett. I am a D2 at Howard University College of Dentistry. Oh, and I guess a fun fact, I don't know if we're doing that, but I'm from Louisville, Kentucky.
Absolutely. Definitely include what year in school you are, what school you go to, and maybe some fun facts about where you're from, anything like that.
Hi, everyone. My name is Angela, and I am a D2 at the University of Pennsylvania, and I'm originally from New York, specifically Long Island.
Hi, everyone. My name is Shelby Farabee. I am a D3 at the University of Maryland. A fun fact about me, I'm from Chesapeake, Virginia, which is a small town in Virginia.
Hi, everybody. My name is Erendira, but I also go as Nona. I was a D3 dental student at Midwestern University in Illinois. So I live in a northern suburb of Chicago called Downers Grove. Something interesting about me, I was born and raised in Mexico City, and I moved to the States when I was 16 years old.
Awesome. Great. Thank you so much, ladies, for that information. I wanted to first give a backstory as to why I wrote the JADA article, just to kind of give some context as to why I decided to write. Having met folks in a lot of the leadership organizations that I'm a part of, and having mentors like Dr. Caswell Evans and Dr. Eleanor Fleming, I felt brave enough to write the story. It's a story that shines some light as to the lives of folks that are non-traditional students going into dental school. I definitely feel like I came from a humble beginning. Both of my parents immigrated to the United States in the 60s and worked really hard, an amazing, just astronomical amount of hours. We lacked the traditional necessities, healthcare. Our neighborhood was not in the best location, so didn't have access to many things. And in many ways, just kind of felt like we were left to fend for ourselves. And so for me, as a child of immigrants, just like many other folks that are part of my X generation, we became the interpreters and the translators for our parents because they didn't speak the language and just felt really uncomfortable going to visits to see their medical providers. And so for me, doing that, I really felt like a secretary for both of my parents, and it was fun at times. But I guess a pinnacle time in my life was when I was 13 years old. My mother started to have a lot of complications, and we didn't know what they were from. And I visited a doctor with her, and this particular doctor seemed pretty rushed and not very interested in what he was doing with us particularly. And I had to share the news with my mother that she was just diagnosed with acute myeloid leukemia. And probably, one of the times in my life where I felt a rush of anxiety, a rush of frustration, and a lot of fear, because I knew what it was like growing up, finding it hard to find simple things like antibiotics. If we didn't have the money, or we didn't have the resources to pick up the prescription. And so as a 13-year-old, having to explain to your mom that she had acute myeloid leukemia from a man that couldn't explain this to her is probably one of the hardest things that I had to do in my life. And looking at that situation now as someone who's an adult and really advocates for training on cultural humility, I feel like if the doctor had some training in cultural humility, perhaps that conversation would have had a little bit more compassion. And so we did as much as we could. We didn't have a lot of resources. And in December of 1990, my mother passed away. It was a really quick cancer. My father fell into a very deep depression and just could not stay home with us. And so he left us. And so I was pretty much on my own from age 13 up to age 17. So it was my brother, sister, and I that just stayed in a small little apartment and tried to fend for ourselves. When I was 17, we found our father. He had been homeless, suffered a stroke, and needed help. So again, jumping into that caregiver role, as a lot of folks do that come from humble beginnings, I was able to get him some assistance. And another really starking experience that I had with my father is that he had severe tooth pain. And when I grew up, at the times that we did, dentistry was a luxury. There was no going to the dentist. And so I remember when my dad had an immense amount of pain, he decided that he was going to drink a couple of shots of whiskey and just take his tooth out. And I remember the day, I remember feeling helpless, but also at that age, knowing that this is just the way it has to be. And it bothered me. I didn't know what social justice was. I didn't know what any of that meant as I understand it now. But it was a scary experience for me, again, as a 17-year-old, to see my father go through this. We ended up taking him to a dental office because he didn't stop bleeding, and he didn't stop bleeding because he was on blood thinners. And that experience was horrendous. I remember being at the dental office and feeling like the staff didn't want us there. They looked at my dad, who was probably not dressed in the best way, and very judgmental. And we had to get the job done. It's not like I could say, well, let me write a Google or Yelp review and that be it. You just feel hopeless without being able to help. And so we were able to help him in that situation, but that experience will never leave me. And so I became an advocate for both my mom and my dad at a very early age. Unfortunately, I lost my father when I was 21. And so in many ways, there was a fire brewing in my belly about there's got to be a better way. And it can't just be me that experiences this. How is it that, in a country where we have amazing technology and brilliant people, and I knew that even when I was young, and it felt untouchable. And even when we were cared for in agencies that allowed for people to provide free services or low sliding scale services, they were always so swamped, and it was almost an impossibility to get really quality, compassionate, culturally competent care. And so going to dental school, for me, I was able to experience that dichotomy of I'm a student who's now entering a professional program, and I can hear students kind of talking about the patients coming into our dental school and talking about them similarly to what I had thought folks would say about us, that we didn't care about our health, that we were sloppy, messy, we want everything for free, you name it. And that's far from the truth for many of us growing up in humble beginnings. Again, my parents were super hard workers. And so writing this article for me provided me an opportunity to share with other dental professionals the alternative, a different lens, understanding that folks feel it. When you go see a provider, they want to be heard, they want to be respected, they want to be understood, and most of all, they want to be seen. And so it was important for me to write this article in hopes of promoting other state dental societies, hoping that they could consider doing a committee within their organization that focuses on diversity, equity, and inclusion. And so for me, it's an opportunity to have these discussions, have folks kind of see a different perspective through a different lens, and have an opportunity to understand their patients better. And not just that, understand me better, right? Understand us better. And so that, in essence, is the backstory and a little bit of information about the article. And now I would love to hear a little bit about your experiences as dental students. And so we do have a couple of questions that we're going to go through. And so if you feel compelled to share after you hear the question, beautiful. I might also give a gentle nudge in hopes of creating some really good conversation. Does that sound okay? Yes? Okay, wonderful. What does being represented mean to you? Is that something that's important, you think?
Yes. For me, this is Cassidy again. For me, representation is seeing myself and my peers and also my faculty, also anybody who works at my college, just that equal representation for me. And that's like throughout everything. That's through my race, through my sexuality, through my religion, just seeing it in every corner, knowing that there's someone I can relate to on any level. That's what representation is to me.
Thank you, Cassidy. And for the other panelists, is it important? Is it something that you think we should talk about? And if so, why?
So to add on to that, I think it's also being able to put yourself in someone else's shoes and understand that not everyone has the same path, not everyone has the same struggles, and that when you're seeing a patient or when you are encountering someone for the first time, you kind of have to take a step back and understand that someone could be going through something in their personal life, or something in their upbringing can affect the way that on how they present themselves to you. So it's kind of, again, just being empathetic and understanding that people go through challenges, people go through different things in life, and you just have to be a little more empathetic and give everyone kind of a chance to explain themselves. And again, just let people share their story, and again, just not being judgmental and understanding that as a provider, you have to kind of be a listening ear for your patients as well, and understand that sometimes you're the person that they come to if they don't have anyone else to go to, and they'll feel comfortable telling you things that they may not feel comfortable telling someone else.
Thank you. Nona, I saw you shaking your head that it was important. Do you have anything to share?
I think for me, I think it's important because like some of my faculty, I'm a very like strong Latino person, and just seeing some of my faculty just achieving their dreams and being like doctors, it just gives you someone to look up to. It just tells other people that have like really high dreams. Yeah, you like it can be done. Like someone else is up there and they did it. So it's just kind of a way to motivate each other that just because we're minorities, we can still succeed and be just as successful as everybody else.
Thank you so much. And you know, when you mentioned the you know, they see us and depending on what the us is, right? It could be that we're female or that we're Latina, whatever it is. Sometimes, and at least from my experience, I remember feeling like it took a lot to convince whoever was asking if I'm the dentist that I was the dentist. I don't know if you all have an experience like that, where folks will ask you, are you the dental assistant? Are you the hygienist? Are you just helping out? And you're like, no, ma'am, I'm the dentist. I'm the student dentist. Absolutely. So I think you're right on, Nona. I think it's super important to start changing the face of professionals in every field, but absolutely in dentistry as well. There's only 5% of the US dentists are Latinos, and I think it's 2.7% folks that are African American. So definitely that needs to change. Shelby, did you have anything to add in terms of what representation means to you and if you feel that it's important?
I definitely think representation is so important in dentistry. I think now I'm a D3, so I've started seeing patients and just being able to, you know, be a voice for a lot of patients who come in and, you know, they haven't been to the dentist in maybe 10 years, and, you know, they were scared and they never saw anyone who looked like them as a provider. And I think being able to see that has been very rewarding, and it's important to improve the success of care for our patients.
Yeah. Thank you for sharing that. I think that's another really important part about representation. I think being a dentist for the past 15 years and having experience with vulnerable populations, a lot of folks just want someone they can relate to. And I think once you feel that you've accomplished that level of trust with your patients, I feel like the treatment planning part is a lot easier. The talking about the prognosis is a lot easier. So you're right on about that, just that relatability, right? And that's important in patient dentist relationship. All right, so I'm going to move on to the next question. Do you think your school supports representation for the overall population of the United States? Cassidy wants to push her unmute button.
I wasn't trying to go first again, but I'll go first. I will say, yeah, Howard, I believe if this still stands, we're the top school for diversity dental school. So it's really representation is really at my school. Like I said, I'm from Louisville, Kentucky. So Kentucky is not that diverse. So now that I go to dental school in Howard and DC, like it's so cool interacting with my classmates who speak multiple languages, and I'm learning about different cultures. I'm learning about different holidays, and it's just something that I never encountered growing up. And I'm 26 now, and I've never had an education experience like this, where I'm interacting so much with people that I never would have crossed paths with had I stayed in Kentucky. So I think my school does a great job representing everyone. Because even like if I say my class, there may be like one or two people of a certain race, like the class underneath me has the opposite numbers. So it's like everything kind of balances out at Howard. So it's like I'm rubbing shoulders, saying hi to everybody. And it's just a great representation for me of the world, because when I go out here and be a dentist, I'm going to serve people of every different type of culture, different religion, not just one group of people. So I love it. I love the diversity of my school.
Kudos to Howard. That's awesome.
Yeah.
Anyone else?
Add on, so at Penn, I can say that I love that aspect about Penn as well. So we are in the West Philadelphia region. So we see patients of every different culture, religion, ethnicity, you name it. And we love that. Like that is what brings so much brightness to our day-to-day, like our day-to-day clinic experience. And just, asking your patient if they lived in Philly their whole life or what country they came from, and finding out that they immigrated from another country and how long that they've lived here for. And a lot of the times you're their first outlet as a provider. So they haven't seen a dentist before, they haven't been to the doctor. So it's really nice to hear everyone coming to you and feeling comfortable with you, and leaving with like such a good experience and outlook. And we love that feeling that we're able to help an underserved population, because a lot of the times they can't afford to go to a private practice in the area. So we provide a lot of that care for the people in our area, and I love that about it. We also accept past students. So Penn takes in about 50 students from other countries starting your D2 year. So again, we have students from all over the world coming and joining our class. And honestly, it like helps us as students here, because we can see how they practice in their countries, and sometimes they help us, and like their skills are so great. And it's amazing to see that, people have skills outside of the US and they bring that here. They bring that flavor, that taste, and it's like so cool to see that. And I will say, even during my interview, they really valued diversity. They loved the story that I had to bring. They honestly talked about diversity in my whole interview, and focus more on that compared to even like anything extracurricular or academic wise. So I can honestly say that they really do take that holistic approach compared to just focusing on your GPA or your extracurriculars, and they want to get to know you and your story and how you can bring that to their school.
Thank you. And I'm going to just change or add to the question. If you were reapplying to dental schools, would representation and diversity be something that if you felt the school didn't have, would you have considered still applying there?
I can answer this. I personally think that I probably would not have chosen a school based on lack of diversity of the school, and the school not making efforts to diversify maybe even faculty and staff at the school. I think one of the highlights of Maryland that I found is that there are being the first dental college, there's it had a different beginning. And I think now they're making a lot of strides in hiring faculty that will relate to students too, to help you get through the program as well. So I really definitely value that. And I think that without the help from a faculty or someone higher up that look like me, I don't think, there's some things you wonder, how far you would have come or without that help.
Absolutely. I mean, I think for some folks that come from, different parts of the world, that mentality of pulling yourself up by the bootstraps is not something that everybody believes in. We're a very individualistic country. And I know for me, even though I was born and raised in the US, the thing that helped me was collaborative care. So it's what you just said, Shelby, finding and seeking mentors and people that, I kind of felt comfortable asking uncomfortable questions. So I echo that sentiment. That's so important. Nona, do you have?
I'm sorry.
Yes, go ahead.
I was going to follow up. I actually did apply to schools that weren't diverse, just because sometimes people say like have a safe school. I don't know if you guys have heard that term. So I did, because I was like, at the end of the day, I do want to be a dentist, but I knew where my heart was. I knew where I really wanted to go. And by the grace, I got in, but I did just for that reason. But if you didn't know, students, you can't get your money back once you apply to school. So yeah, that money's just gone.
That's right. That's right. That's right. And you're right about that. Sometimes we don't have a lot of options, and as folks that are applying to dental school, you're going to apply and you're going to put that net out there, and wherever you're called to, many times if our heart is set on becoming dentists, that's where we have to go. Nona, did you have something to add?
Yeah, I think I just wanted to add a little bit to her. Like, if I was to add, if I was to have to pick between two schools, I think diversity is one of my main things that I would look for. I would definitely consider not going to a school or picking one over the other one that was a little bit more diverse.
Thank you.
Because I just didn't see that when I was in undergrad.
And for some folks that are part of a different type of representation, sometimes it matters to them even more, right? So sometimes they just have to feel safe in a certain environment. And for that reason, I think right? Yeah, sometimes there are committees that help bring this out, or at least establish that there is a value of representation in their institution. So I think that says a lot. So my next question is, what role do you think the ADA, State Dental Society, and local dental groups have in making sure that representation matters? So, our schools are super diverse, it sounds like, which is great. It wasn't like that when I went to school. There were only 5 or 6 of us in a class of like 90 to 100. And very small, group of folks. And so I had my own thoughts of what I wanted the world to be and to welcome a certain way. But what are your thoughts? What role do you think these leadership organizations have to welcome this group of folks that are coming out that are far more represented? I saw your eyes, Cassidy.
I'm thinking, because this is a great question.
Yeah.
But my answer needs to be on spot, because they're taking notes. Let me think.
Dr. Winthrop is taking notes.
I guess I can try to stab at this question. I think the ADA does have a really big responsibility as far as like making sure that there is more diversity in dental schools, and that there is representation in the practitioners that they, help that graduate from these schools. I think maybe, and also educating us. I know our student body is very diverse, but also we all come from different experiences and backgrounds. And I think creating avenues in the curriculum to like address, how like cultural humility, and address how to be more like how to represent our patients more and be more holistic practitioners.
Thank you. Luma, you look like you got something to say.
No, I usually talk after I was waiting for a panelist. I'm like, not all at once, please. But I go to school in El Paso, so there is a big thing, and we have like a majority Hispanic population. There is a big thing at my school for like us learning how to speak Spanish, or it's called creating culturally competent physicians. The theory is amazing, that if it can be applied, it will really be great, because it's making sure that you understand where that patient is coming from. And the part that I try to like advance with the school as well is that there is like culture, as much as you can put it under an umbrella, there's like several parts to that umbrella. To really be culturally competent, you do not have to learn about all those parts. You just have to be empathetic about those parts. So if someone can say, this is important to me, because like we have like Hispanic patients that need to check with their whole family before they accept the treatment plan. You need to understand that some people will have to do that and do it. As far as like the government organizations like the ADA, it will be like challenging to be able to influence the curriculum in that directly, that it might end up having to try to influence your practitioners. But as far as the students are concerned, it is good to introduce it, but it will be better to give an incentive to the practitioners.
Thank you.
And I could bite my tongue again.
To kind of add on to that, so I do agree that it's important for the ADA, a national organization, to get more involved and like advocate for that. So again, it's kind of hard to tell such a big organization to do that. So for example, I'm a part of ASDA at my school. So it's having a smaller kind of group that can advocate for cultural competency was something that I kind of sought after. So I kind of took it upon myself to find something that will let me share my story or understand a little bit more about cultural competency and how I can apply it to taking care of my future patients. So again, it's not from a national level, but ASDA still is a student-run organization at my school that really values and focuses on, again, letting the dental students know, well, you're going to have patients from every path of life, every walk of life. It's important for you to understand where they're coming from, the struggles that they can face. What can you do to help ease their stress, their fear coming to the dentist? So again, being part of ASDA was like a great outlet for me. So again, maybe having more of an advocacy role in smaller student group settings like that at each school can definitely help play a role, I think. So again, it's just, if you have a passion for it, again, it's definitely possible, even in a group setting like ASDA. So again, we're hosting that fundraiser for the Diversity in Dentistry Mentorship Program. So having like-minded individuals who care about the same thing, I think, is important to find so you can get that spark going.
Thank you. And that makes me think a lot about, you know, for folks who are with us today that are applying to dental schools, if this is a topic that is important to you, I would say ask this, you know, when you go for your interview, ask what they do. Do they do cultural competency or cultural humility training? How does that look like? And that says a lot about the institution that you're potentially going to be a part of, but it also helps them view you as someone who is looking to be a very empathetic practitioner for everyone. So thank you for sharing that, Angela, and thank you for your work too. Oh, that sounds exciting. Anybody else? Yes.
Okay. Yes, I'm sorry. I was gonna say, I know at my university, I'm still a little new, not that new, but still a little new. I know we have to do like cultural competencies before we graduate, so that's something to incorporate as well. I know in undergrad, for me, one thing that like University of Louisville actually did really well, they had like an LGBTQ certification that I could have got. So I took like certain amount of courses and learned about different issues and topics. Yes. And so I got a certificate. So that's something that maybe ADA or the American Dental Association or any nationals can incorporate that. Just so like maybe when we graduate, like we can have a certificate saying that we have like achieved this many hours in doing this or just building the cultural competency. And also I would say that sometimes it even starts before going to dental school. So maybe just hosting like little events like in different regions or organizations or communities, so like people can see representation of going to dental school. Because for me, like there's not that many Black women dentists in Kentucky, So when I found one, I latched onto her really well. But that took me having to find her, and that took till I was like 18 years old to find one. So it's just like having that representation, because I believe like if we can see it when we're younger, then we can dream it and we can become it. So that'll increase your diversity when it comes to school, or it'll increase your cultural competency because you'll be having more culturally competent people coming in. So sometimes you got to start from the very bottom before we even get there, because sometimes once you get to school you get a little stressed out and you run through a little training sometimes, but if you can start early before we even get there, it'll prepare us.
Absolutely. I think that's an excellent point about starting early and encouraging or enticing the interest of other folks. So one thing to think about for all of you wonderful student leaders that put together service events, I purchase white coats for children. We don't discriminate because of size. I've got from extra small to double X, and the children are able to put these white coats on. And usually I have a nice table that allows the kids to play with the Play-Doh. I don't know if you guys have seen that Play-Doh dentist kit. It's amazing. And, you know, their moms take pictures of them holding the toy, the little plastic mirror, and having the white coat on. And the fact that you're there and you look like them makes them feel, just like Cassidy said, I can achieve that, you know, and maybe I do want to look into that. It stays in their memory. And, you know, when they're ready to go to school, that might be something that they consider. So thanks for sharing that. So we have 20 minutes left, and I know that the good folks at Diversity in Dentistry want to take some questions from our listeners, and so I think I'm going to do that. Luma, are you going to help with those questions, or can we access them?
I can help with the questions.
Perfect.
But I just wanted to throw in that what Cassidy said is like really important. I thought I was sending Dr. Lila a private message, and it went to everybody. I'm like, she's talking about the youth summit, which is what we try to do with diversity in the industry. This will be a third youth summit. We are looking at like middle school and high school students. They have like the white coat ceremony and all of that, because half the time, like if you can unlock that core memory and create it, they can like follow it throughout their life. I had asked earlier that if you do have any questions, to please go ahead and put them in the chat. If you have not done so, you can go ahead and do it. But if not, I always have like unlimited questions that I could get started with. So if you have a question, do put it in the chat, or I'll go ahead and continue and ask more questions, because I have the opportunity to have Dr. Lopez share her ideas and the rest of the panelists as well. So while we wait for everyone to put in your questions, we had one of our mixers that where one of our other mentors shared, how do you, like, as we all know, most of the schools that are available are not predominantly minority, apart from like Howard or Meharry. So how do you actually go about in like finding about the diversity and inclusion in the other schools? Like, you can ask during the interview and they'll tell you what they want to tell you, but how do you check it to make sure that it is something that you can do? Or I'll start with you, Dr. Lopez. Like, how do you advise that for someone that is interested to go ahead about finding out how that diversity and inclusion work in the school that they're planning on going to?
So there is the accreditation folks that, you know, monitor these things. It's called CODA. And so they actually want this information as well from every dental school. And so the admissions department should always have data that tracks folks from different backgrounds. So one thing to do if you're interested in a dental school, obviously, is do your research and Google, ask people, but call the admissions office and ask if they can share with you their admissions from the previous year, and say, would you mind also including whatever representative information you're looking for? So every dental school has that info, and usually the admissions committee is the best place to ask.
Okay. For any of the panelists, was that a consideration for you? How did you go about doing that? If anyone would like to share.
Oh, I was gonna say, me personally, sorry. I looked at social media sometimes just so I could see, because these days we're all about social media. So I'm like, you should have representation on social media, whether it's on Instagram, Facebook, or your website. I would just look on that. And then if you feel comfortable, maybe messaging a student who looks like you and just having that conversation with them, because that makes all the difference for me. So, because sometimes it's like admissions will get back to you, but sometimes it takes a while. And
No.
sometimes admissions going to tell you what an admissions person is going to tell you versus actually talking to a student. It'll be a different experience. So just stay professional, but just get the questions that you want answered.
Yeah, I think for me, like just messaging a current student, I think that's the easiest way to get information about the school. They don't have to lie to you. Like they don't have to hide anything. They'll just say how it is. I think another resource is the Dental Explorer by Adia. There, if I think it's like $20 for the whole year, so all the pre-dents that are online. You can purchase this. It's good for a year, and it gives you the breakdown of like how diverse the schools are. I don't know if how updated it is, but supposedly it's like the latest updates. So that could be another resource to see how diverse the schools are.
Yeah, for me, I'll always go with asking the current students. I'm a very non-traditional student, so it is like amazing to see what people will put on social media. So do take advantage of that and reach out to like current students, because they'll always tell you what is going on. Dr. Winthrop did ask about the DEI statewide bans. Do we have like any feedback, any feelings, any concern about the fact that now, or maybe going forward, we are not allowed to have like DEI departments on how to handle that?
Yeah, I was really sad to hear that DeSantis was really trying to ban so many efforts that so many folks that come from different backgrounds have fought so hard for. And honestly, it's a slap in the face. It's literally like saying your story does not matter. It's not any different. Get yourself back up from the bootstraps. And we know that that's not true. We know that everybody has different struggles based on what your upbringing was. And yes, I will say honestly, there was a little bit of resistance even for my state to have the Diversity, Equity, and Inclusion Committee be a part of our state dental society. We became number 4 or 5 in the country, guys. That's ridiculous. I know but it's ridiculous that we only have 4 or 5. And it matters. It matters so much. The thing is, you have to speak your truth, even if your voice shakes, even if you're the only person in the room, even if you think you're going to look crazy, say it anyways. You'd be surprised how many allies are in the room. They're just a little afraid of saying something. And so, yes, there is that attack, Luma, and it's very real. But we got fire in our belly. And look at all of you guys. You guys are all really strong, motivated professionals coming into the field. That makes me so happy, because it feels like sometimes you're alone. But just keep your voice strong, keep moving ahead, tell people your story. It matters. Remember that those who are in those vulnerable communities right now, they don't have a voice. They can't get on a podium. They can't tell their story. And we're listening to people just throw them to the floor, talk smack about them. And our job is to protect them. And so, again, just stay strong, keep using your voice, because it matters.
Thank you so much, Dr. Lopez. Any input from any of our panelists regarding that?
That was beautiful. That was beautiful.
Thank you.
Yes, I'm gonna agree, because your story, like I have a unique story. So, like you said, you have to advocate for yourself, and I strongly believe the better I can advocate for myself, the better I can advocate for my future patients. So that's why it's important for you to speak up, tell your story, because you're gonna be a leader. You're gonna be in the dental field. You're gonna be serving a community, people who feel like they have no voice. And so you will be a voice for the voiceless. So it's how will you use your voice to make the world of dentistry better? And that was like my personal statement. I was like, yes, I want to use my voice. And I want to make sure that I go to a dental school where I know my voice will be heard. So
Thank you.
but that was wonderful. That was wonderful.
I
That
know.
that
I
made
was,
my
I
heart
was holding
warm.
myself, I'm cheering.
Same.
But anything else from the rest of the panelists? I know like asking about like the DEA and things like that might seem out of reach for us as students, but I would just like to emphasize that it does matter. Because for instance, like for SNDA, like the Student National Dental Association, most of our funding for the activities that we could put up came from our DEA office, and without that we cannot put up a lot of the programs that we could do. And this was like the one time for people that look like us to see people like us in the positions that we were in. So it's just like the little things, like it might not mean much now, but down the road it might. Which we are at 19, so which brings me to my last question. My question was this: we talk a lot about like advocating for patients and for everybody else. How about for us? Where do you think, like, how do you think you can advocate for yourself in DEA? Because I am one of 6 African Americans at my school. What can I do? And starting with Dr. Lopez and the rest of the panelists, like, you can advocate for your patients, but how about you?
So, there's a lot of intersectionality again. I think I heard you say that you're a non-traditional student. So, you have different needs, you have different wants. One thing that just happened last night, we were trying to, in my local leadership group for Chicago, we were trying to decrease the number of CE meetings that we have from 7 to 6, which is reasonable. We're not talking slashing half. And there's a good number of older dentists, some retired, that feel strongly that they should keep the 7 because they want to continue seeing each other and having conversations, kind of feel like they're still part of the community. Well, guess what? There are mamas and people who are not just part of the Chicago Dental Society, but we're also part of the Hispanic Dental Association, and we're also part of nonprofit organizations, and we're also not only taking care of our family, but taking care of our moms and our dads and so we have so many other things. And you speak up. I said, well, that's just not going to work for me because I've got my kids, they're waiting for me. I've got to do calculus homework. I gotta hug and cuddle them. I know they're teenagers, but they need that. So standing firm in your ground and making sure that you don't just go with the norm because everybody's saying yes, you're going to be the only oddball. You got to stand your ground and say, that's just not going to work for me. And then you also have to remind folks when we talk about inclusion, that's what inclusion means. If you really want to be inclusive, you've got to consider the needs and wants of everybody in your organization. So, yeah.
Thank you so much for that. Angela, last word.
Yeah, I was just going to add, so again, I think the biggest message is having a voice. So, for example, I am an Afghan woman, so it is very hard to get an education as an Afghan woman in Afghanistan. I come from a family of immigrants. So again, having that spark and that fire in your belly, like you said, to be successful, there's no other option. So again, you have that fire in you to prove that because you had obstacles growing up, because you didn't have as much compared to someone else, you kind of use that as your fuel and your fire, and you do things like this where you share your story and you let other people hear your story and let them know you're not alone in this. And that, again, not everyone's going to have the same resources coming into dental school. And again, understanding that you're not going through this alone. There's other people doing it like you. There's other people struggling like you. And again, just advocating for not only yourself, but the minority group that you're representing. So again, that voice is just so important. And just keeping that in the back of your head and everything that you do, I think, is so important, and never losing sight of why you're doing this and carrying it into your day-to-day life. And like, there's going to be days where you're going to have a rough day, and you have to remember you are so privileged and lucky and blessed to be in the position you are today, and you're representing all the minority groups that don't have that opportunity that you do.
Thank you. That was beautiful. Anybody else care to share? For me, like one of the things I've learned from Dr. Laila, I'm not even sure she knows she teaches me that, but if you have a voice, like use it, even if it's just a whisper. Like if you don't use it, like as there is some meme that was going around, like don't kill you until you enjoyed it. Like even if it's just a whisper, like use it. Like speak up, especially for yourself. Like you cannot advocate for anyone if you cannot advocate for yourself. Like speak up. It is really a challenge because coming for a lot of us, as Cassidy explained, you have your backup plan for school. There is not a lot of options for where you can go to, where you can be represented. As I mentioned, I'm one of 6 African Americans at my school, and we are at the border, like, because for me, like what like solidified it for me, we have a lot of like the migrants coming in, and I one day we had like 60 migrants all coming, and they're like, oh, they need someone that can speak French. And it was all these Haitian migrants with like, they had like so much more going on, but they could put up with it, but they could not put up with like, the toothache, the bleeding gums, and all of that. But what are the chances that they'll be in El Paso and meet someone that can speak to them in French? Like for some of them, it was like, I have been working for almost 2 years. This is worth it to see that someone will even understand that this is my pain. But the biggest thing for me when it comes to DA is that it is not about different, it is about other. And other is not always bad. And you can learn so much more from other. It is not different, it's the other. But to be respectful of everyone's time, we will end here. However, diversity in dentistry, as the name stands, which is ironic with DEA, it's a mentorship program that, because honestly speaking, like Cassidy shared, she met a Black African-American woman dentist and she latched on. Like, it's very difficult to navigate these dental academic streets by yourself. You need someone, even if it's just, if you can find a mentor, someone that is where you want to be, latch onto that person. But what I am learning in school is that it is even more important to find people you can laugh with, cry with, complain with, grumble with. But in every situation, please do find that community that can advocate for you and advocate for you, and that can advocate for you and that you'd be interested in advocating for. Diversity in dentistry, we have these webinars every month. There is one every month. If you do not have the time to join, please do watch it again on YouTube, because most of it are recorded. If not, we have amazing people like Dr. Lopez that will volunteer their time to get on here or mentor one-on-one. But we do have an even bigger community that does not have the time for that, but they're available on their social media. So if you can please make time to follow our social media pages. We are on Facebook, we are on LinkedIn, we're on Facebook, we're on LinkedIn, we're on Twitter, we are like on all, we're even on TikTok. I don't know how that works, but we're even on TikTok. So follow it. And as I mentioned, use your voice. Like, use your voice. If you're running into something, it's better to put yourself out there and have nobody respond than to hold it inside. Ask it on there. You have our emails, like reach out to us. But please use your voice. And if you don't use it for anything, use it to stand up for someone or for yourself. But better for yourself, even better if you're standing up for someone. So if we don't have any more questions, we do have the feedback, the poll on there. Please respond. To all our panelists, thank you so much. Getting into dental school, making it through dental school, or like the first few years, it is not easy out in these dental streets. Thank you all so much for making this time on a Wednesday. I know it's like hump day for a reason. Thank you all so much. We appreciate you. Please do keep in touch, especially you, Angela. Please do keep in touch. We thank you for all